Lizzie and I are going to show you 7 movements to try to improve your low back pain and mobility. This exercise is going to be a prone press up. So you're just going to lie on your stomach. She has her hands, just whatever position feels best to you. She's going to press herself up. And when she comes up, she's going to hold that a few seconds and then come right back down. And then press up again and then come right back down. She's going to repeat this 2 to 3 sets for 10 to 15 repetitions. Initially, if she has a lot of low back pain and a pinching and jamming sensation here, she would not go up as far. So maybe she pushes up just a little bit and then comes down and then works her way into that full extension movement. But again, that is a prone press up. These are opposite arm, opposite leg extension movements here. So what Lizzie's going to do is her right arm and left leg move together, and then her left arm and right leg move together. The trick with this is to try to keep the low back area nice and flat, and she just goes through the movement as far as she can, and she repeat this for 2 to 3 sets of 5 to 10 repetitions with each arm. This exercise is Superman's, and so what she's going to do is bring both arms and both legs up at the same time, kind of in the shape of a V or a U, and stabilize in the low back area. She's going to repeat this for 2 to 3 sets, 10 to 12 repetitions. Now Lizzie is going to perform bridges, so she's just going to bend her knees. She has her arms down flat, pushing up, trying to create that flatness in the low back, almost that straight line right there. She's going to repeat that for 2 to 3 sets of 10 to 12 repetitions. As she becomes more comfortable with that, she can also add a weight or a plate or a small kettlebell or dumbbell across the waist and hold on to it while she performs this movement. These are side planks, and so initially, if you can't hold this position, just kind of go up and then come back down. You're going to repeat this for 1 to 2 sets, 5 to 10 repetitions. This can be a little difficult. Really focus on control more so than completing a high repetition range. Now Liz is going to perform a self lumbopelvic mobilization. So what she has here is the right leg is straight, the left leg, the knee is bent, the foot here is behind the other knee. She has her right hand here, and she's going to push on the top of her pelvis forwards. At the same time, she's rotating to the left with her head and her shoulder, just creating that lumbopelvic mobilization. And she would hold this somewhere between 10 to 20 seconds and repeat this for 10 to 12 repetitions. The last thing Lizzie is going to do is going to be knee to chest stretches here. So she's going to pull her knee up, hold that, bring that back as far as she can. She's trying to hold that between 20 to 30 seconds and then repeat the same thing. We're going to go on the other side. You can do that on both sides for somewhere between 5 to 10 reps, or honestly, just as many times throughout the day as she can, whether it's in a seated position or whether she's able to get on her back. Either way is fine, just stretching that lumbar region. Thanks so much for watching. We hope these tips help to try to improve that low back pain and lack of mobility that you've been having. Thanks for watching.